Well, the Oz broke that yarn. Ewan Hannon and Damon Johnston today's Oz. Tomorrow they've got a great follow-up. But let's go to the Oz and have a look at the splash tomorrow, because it's budget-related, which I'm sure a lot of people will be very interested in. Headline, of course, jobs rush to slash COVID welfare bill. The nation's $32 billion COVID welfare bill would be more than halved over the next 4 years, and JobSeeker recipient numbers return to pre-pandemic levels, with a rapid rebound in the jobs market to be revealed in next week's federal budget. But the Morrison government has warned it will not jeopardise the economic recovery with a rush to reopen international borders amid global outbreaks and uncertainty about the speed of the vaccine rollout and its effectiveness. Look, Scott Morrison's under a lot of pressure at the moment. There's many suggestions that he's lost his mojo, and there's no doubt that next week's federal budget will be incredibly, incredibly important. But let me say this, Caleb. I don't think there would be a country in the world, possibly the exception, maybe Taiwan, who has handled this pandemic as well from a fiscal and health perspective as this country. And I can tell you what, yes, the states will claim that they've been the ones that have driven the lockdowns and the border protection measures, but it's the federal government that has kept this country going with its fiscal policies, particularly around JobKeeper and JobSeeker. And of course, it has made absolutely certain that it has done the right thing by Australians when it comes to the health narrative.
Yeah, in terms of the economic story of coronavirus, you really couldn't get any better than we have had it in this country. The response was quick and decisive from the federal government. And as much as the states would like to take credit for everything that was done to combat coronavirus in this country, the cost of all of that was borne by the federal government, and they did an excellent job of it. We've come out the other side, I'm not going to say better off than we were before, but you know, we're pretty well getting back to where we were, and we've done that in the space of 12 months. And if you told me 12 months ago that we were going to do that, I would have said you were a fool. But the policy was excellent, the execution was excellent, and the results, you know, have proven it. The proof of the pudding is in the eating. And we have seen that by getting on the front foot, by ensuring that people did not end up in a position where they didn't have any money, and that was the real risk, as we all knew that people weren't going to be able to work for various reasons, and we had to basically prop up the economy for a while. The federal government stepped in and did it. We were under no illusions that that was going to last forever, but it was quick, it was decisive, and it was effective. And we are seeing the results of that now in the economy, in people signing up for houses, spending their money on local tourism, getting back into work at a rate of knots. You know, it is a really positive economic story. And, you know, I've said this before, but it will leave us with a large amount of debt that we have to deal with. The idea that perhaps will not be as large as previously predicted because we've been able to wean people off of that welfare earlier is good news, but it doesn't mean that we're not going to end up with a large amount of debt that we have to deal with. But the footnote to that story, of course, is this idea that we're not going to rush into opening up international borders again. Get the vaccine in people's arms. I mean, we seriously have to hurry up here. If there's anything that's going to reflect badly on this government come election time, it will be a slow rollout of the vaccine. And that's basically what we've seen so far. Things are starting to ramp up. But get it in people's arms, and then we can start talking about opening our borders again. Other countries are already doing it. We're in a better place than anyone else. We really should be ahead of everyone else in terms of discussing these things.